When most people hear the word trauma, they think of these extreme events. But if you have watched my video on what is trauma in a nutshell, you will already have some base knowledge that trauma is less about the event and more about the stress that was in your nervous system at the time and the capacity you had left to deal with any new stress that was coming in, potentially from an event that was happening. This video is about different types of trauma that we talk about and know of in the therapeutical space. Trauma is really difficult to categorize because it is about the individual person and what they have the capacity for, about whether the nervous system experiences trauma or not. However, there are these different categories of trauma that we do talk about, and learning a little bit about this, you might be able to answer the question if what you went through was traumatic for you. So before we start this video, as it is a trauma-informed video as well, I want you to just take a few moments to ground yourself and make sure that you are well resourced. So you can grab a pillow and hold on to that, take a nice, long, gentle look around your room, feel your sitting bones and your back body in your chair. Take a couple of comfortable breaths. And most importantly, as we talk about trauma, it is really easy and common for us to feel some activation in our own system as we are learning about things, because the body remembers, and we might feel some activation or some stress within our system. Please know that you can pause this video at any point, and what's the most important thing to do is learn little by little. Allow what you are learning to integrate. Don't just keep piling more and more information on top if you feel like you do not have the capacity for that. We use a term in the trauma space called titration, which is where we're just doing a little bit of work at the time in order to help restore safety into the nervous system and not to flood our nervous system again. So please resource yourself and feel free to pause at any point. The first type of trauma that I want to talk about is acute trauma. So this is that trauma that is too much, too soon. It's often a singular event, something extreme that happens in a specific short time period. It could be, within a minute or within an hour or something like this, or maybe within a day. And this overwhelms our nervous system at the time. It's a really intense event that pushes our nervous system to its capacity in that moment. And this is, I'm just looking at my notes here, acute trauma is often caused by things like assaults, by accidents, by what else? Sudden loss, or being in a disastrous event or something like this. This is an acute, this can contribute to what we know as acute trauma. The next type of trauma is chronic traumatic stress. And I also have a video on this, which is what is the difference between burnout and chronic traumatic stress. And chronic traumatic stress is when we experience multiple extreme stresses that affect our safety. So we feel like we are in survival mode because something is happening which is affecting our ability to feel safe and secure. And it's chronic because it's something that happens over a long period of time. So examples of this can be job loss, slow demise of a relationship, homelessness, dealing or with a life-threatening medical concern, etc. So really intense stress that's relating to our ability to meet our base physiological needs over a prolonged period of time. Next, we have developmental trauma or attachment trauma, and this happens in our early years, often before we can speak. So our primary caregivers weren't able to attune to us. They weren't able to meet our needs. Perhaps there was also some neglect there, inconsistent caregiving. And another example of relationship early developmental trauma is where the child is also overly aware of their parents' emotional states and needs. So having to grow up too soon to take care of a parent or a caregiver can also cause what we know to be childhood and developmental trauma. Relationship trauma. So this type of trauma can be caused when you believe that you are in a loving, caring, secure relationship, but then there is some kind of abuse, some kind of betrayal, some maltreatment, some manipulation, invalidation, and really unstable and unpredictable dynamics within the relationship. Next, we have trauma which is caused by loss. So losing something or someone very suddenly can obviously really overwhelm our nervous system in that point, to the point where it becomes a very traumatic experience. You can also, when I say somebody or something, of course it can relate to death, but that can also relate to like losing a home, losing a job or a career. Yeah, I think that's a good example. And finally, well, not finally, sorry, then we've got medical trauma. Medical trauma is we can experience trauma learning that we have to go through a medical procedure which causes an overwhelming amount of fear in our nervous system. So if you've ever felt you've needed to have an operation and you felt very, very scared to do that, that is a form that can cause trauma in the nervous system, as well as dealing with long-term pain and life-threatening illnesses and situations, and also injuries as well. And there's generational trauma. This is trauma that it wasn't something that you experienced yourself, but something your parents or your grandparents or previous generations experience, and then they pass that trauma down to the next generations. And we have vicarious trauma. Vicarious trauma is a lot easier to experience, and a lot of people do actually carry vicarious trauma and have that, because vicarious trauma is caused by us witnessing something traumatic happening to somebody else, or it can also be caused by us being very, very scared. For example, through watching a horror movie where something terrible is happening to another person, our nervous system cannot tell the difference between whether that fear is real or just perceived, like through, it's not actually real because we're watching a television. Our nervous system doesn't always experience it like that. So you can experience vicarious trauma through watching something like a horror movie, but often vicarious trauma is something that people experience if they've been in the police, if they've been in the armed forces, if they've been in the emergency services, and they've had to witness other people going through lots of trauma. And then we have identity-based trauma. So this is where you had to hide a part of yourself in order to be able to survive, whether that is to do with your race, your ethnicity, your religion, your faith, your sexuality. There are many, many different examples of this, but we have to hide who we are because we're not in an environment where it's safe for us to be who we are, where there's a possibility of us knowing that we're going to be our base physiological needs aren't going to be able to be met if we are authentic to ourselves. This suppression causes this need to suppress who we are to survive can also overwhelm the nervous system quite easily. And so to conclude, trauma doesn't easily fit into categories because I've given a wide range of examples, and it's not an extensive list that I've shared today. And it's not for you to label or diagnose yourself. Yes, I've got that. Yes, that's happened to me. This video is just about giving you examples and a brief, in a nutshell, insight into the different types of trauma that we talk about and know about within the therapeutical space. And if any of these resonate with you, then hopefully you'll be able to take that information forward to get the support that you need, at least as a starting point. Essentially, trauma is just when our nervous system is either overwhelmed or so depleted that it goes into a state of protection, and that can occur through hundreds of thousands of different ways, and only you will be able to know if what happened to you had that kind of impact that we talk about. So my name is Donna Louise, and I'm a trauma-trained somatic practitioner, functional breathwork coach, clinical EFT practitioner, and I'm also a trainee counsellor. If you've found this video insightful, if you've got any questions, please go ahead and put your comments or your questions in the comment box below. Give this video a thumbs up and follow and subscribe. If you are looking for some one-to-one support for your own healing journey, you can find the link to work with me in the description. Thanks so much for watching, and I'll see you soon.